Hello class, we're going to go over chapter 42, assistant in other medical specialties. Now, as you know, when you're working in other specialties, you learn a few things a little bit different, even though you may get a little bit of everything in a family practice or internal medicine. But if you work in specific specialties, it's important to make sure that you understand what is going on in that particular facility. Like first here we have allergy. Now when we're dealing with an allergy clinic, the person that we're actually dealing with and that specializes in this is called an allergist. They specialize in diagnosing and treatment of allergies. Working in this type of office will require you as the medical assistant to be familiar with different types of allergic reactions. Now when we're dealing with cardiology, the person that specializes this is the cardiologist. The cardiologist is specialized in heart disease and disorders. For you to be able to assist a cardiologist, you as a medical assistant need to be familiar with the structure of the cardiovascular system and any of the associated typical exams and measurements that will be used. They do utilize different types of imaging techniques such as echocardiograph or other x-rays as well. If you work in the dermatology office, the person that deals with this is a dermatologist. They diagnose and treat skin disorders and diseases. If you work in this particular setting, you may be required to perform different types of procedures such as administering sun lamp treatments and applying topical medications. There are also a possibility that you could do any type of injections as well. In endocrinology, the specialist of this one is called an endocrinologist. They deal with the disease and disorders of the endocrine system. These are your glands that regulate and coordinate the body's system. Inside of the endocrinology office or endocrine office, you as a medical assistant will examine and collect specimens for different types of analysis. Now let's take a look at the gastroenterology clinic. We're dealing with a gastroenterologist who will diagnose and treat different types of disorders dealing with the gastrointestinal tract. If you think about the gastrointestinal tract, we're thinking from mouth to anus. And you can also be evaluating the different accessory organs such as the liver and the pancreas. And then inside this same office, you could have a proctologist. They specializes in the disorders of the rectum and anus only. Now, they can also do colonoscopies as well. And as you know, when we're dealing with a colonoscopy, we're talking about the viewing of the colon. So when you think about colonoscopy, we're only viewing the colon. This procedure is done by the medical assistant. It's just basically where you are helping with the patient's understanding of the preparation of this type of procedure. Neurologists, they diagnose and treat diseases and disorders of the central nervous system. They do different types of diagnostic tests such as electroencephalography. These procedures often need the help of you as a medical assistant when they're going through that procedure. In an oncology clinic, which we know deals with cancer, the person that specializes in this is called an oncologist. They specialize in the detection, treatment, and of the tumors and cancerous growths. Now, as we've discussed in previous chapters, we've talked about there being different types of tumors. They can be benign, which means that it is non-cancerous and may cause disruption to the surrounding tissues. But when we talk about malignant, we are talking about tumors that are cancerous and capable of metastasizing or spreading throughout the body. Now, our last one on here is orthopedics. Now, the specialist for this one is considered an orthopedist. This one specialist focus on disorders, injuries, and diseases of the muscular and the skeletal system. The main responsibilities of the medical assistant in this era is just include in making sure that the patient getting their x-rays, they get casting, applying hot and cold packs for treatments, and educating the patients about the different types of therapy regimens. Now let's take a look at some of the cardiology diseases and disorders. I'm not going to actually go over every last one of these, just because I'm just going to maybe pick out a few of them and talk about them. Just because in your book, if you take a look in your book for your cardiology, you can look on page 883 in table 42.2, and you can get the common conditions and treatments for these different types of diseases and disorders. But I'll just take some of them and talk about them, but please go back and review the table, which will give you some more information. But as you know, the cardiology is a common specialty practice because cardiovascular diseases and disorders are at the top cause of mortality in the United States. While various pharmaceutical solutions are offered for each category of diseases and disorders, other resolutions may be possible. Let's take a look at the arterial and vascular disorders, but you do know when you are going into cardiovascular, it's very important that you are familiar, like I said earlier, with the cardiovascular system. Now, your arterial and vascular disorders, they include things like aneurysms, arteriosclerosis, atherosclerosis, hypertension, varicose veins. Surgery is possible treatment along with lifestyle diet management. And a lot of people don't like to hear that word when you talk about diet management or lifestyle changes. Like everybody just goes haywire when you talk about diet management or lifestyle changes, because most people don't want to change their lifestyle. But with most things that we have going on in the world and things and diseases and disorders that we have, if we just take a little bit of time to change up some of our lifestyle changes and change our diet, it can actually help with a lot of the things that the diseases and disorders that we do have and we are getting. Varicose veins we talked about before. We talked about helping that can use elastic stockings or compression hoses. Coronary artery disease, which we know deals with angiopectoris and myocardial infarction, which y'all know that is a heart attack. Most times just getting medication, rest, and lifestyle management along with oxygen administration may also be helpful. People get dysrhythmias. That's where your atrial fibrillation, conduction of delays or blocks, or tachycardia are help with cardioversion or use of a pacemaker, which we will talk a little bit more about that when we get into the ECG chapter. You guys have heard of congestive heart failure and weakening of the heart muscles. Really, cardiomyopathy is what it's really called. Treatment modalities range from medication, of course, diet management and rest, to a complete heart transplant, because people do have to end up getting those. You can have inflammation of the heart tissues, which you guys have learned in anatomy and physiology about the endocarditis, the myocarditis, and the pericarditis. All of these are the different layers of the heart. The valve surgery may be needed for endocarditis, which includes the heart lining and valve, but specific treatment is directed at the underlying cause. And then, of course, you have your valvular disease, which includes aortic stenosis, mitral stenosis, mitral valve prolapse, which may require surgery. And all of these are the different portions of your heart. You have dermatologic conditions. And as y'all know, the skin is the largest organ of the body, making skin disease and disorders a major concern. Patients with skin disorders may also worry about the appearance of themselves. Acne is one of the biggest things that people tend to have, especially in teenage years, because you know acne, of course, is inflammation of the follicles of the skin, oil glands, causing underside skin eruptions. And then, so we having to give the patient antibiotics, contraceptives, retinoid, or are used to manage the outbreaks. There's a such thing as contact dermatitis, caused by irritants such as rough fabrics, cosmetics, pollens, or plants such as poison ivy or poison oak. So depending on the cause, depends on what type of treatment we would give for the type of lesions. So you have anti-inflammatory medications. Antihistamines are most of the time used if it's for severe cases. Now, eczema is one of the other things that people tend to It starts out allergic reactions mostly in small children. That's why it's important to make sure that when you are giving and introducing your children as infants to foods, that you want to make sure you give them one at a time, because you have to see if your child has any type of allergic reaction to a particular food that can cause an allergy response. So with that being said, the inflammation that comes from eczema may be from allergic response to allergens such as chemicals, or it could be from foods. So a combination of therapy and lifestyle changes is also needed to control the flare-ups. Another one, let's look at psoriasis. Presents as patches of red, thickened skin with silver scales, mostly found on the knees, elbows, scalp, face, palms, and soles of the feet. You have topical creams and ointments along with light therapy that can help to reduce these symptoms. So if you get that, they try to get the patient on these and have them use it on a regular basis. And a lot of times you see this in a lot of your older patients most of the time. Ringworms is very big amongst children as well. You get the ringworms that affect the feet. This is known as athlete's foot, as you probably heard before, and I think we talked about this before. It can also be seen in the groin. This is what we call jock itch. Or on the scalp. This is what we call tinea capitis. Things that we do to treat these could be topical antifungal medications, but if it's a more severe case, we may have to end up giving them a oral medication so they can ingest, so they can have it fighting from the inside as well as from the outside. But the one thing that is very important to know is that ringworms are contagious. So a patient should not be sharing their bedding, their combs, their towels, or any other personal items that could spread that particular disease or disorder. We've talked about warts before. Warts are benign skin tumors that result from a viral skin infection. The most common warts usually occur on the hands and the fingers. Then we have also what we call plantar warts. They appear on the soles of a person's feet. And then we have venereal warts. Venereal warts are where we were talking about last week about them being in the genitalia and the anal area. These are considered to be transmitted through sexual contact. So in order to treat this, it just really depends on it really just depends on how what type of wart it is, because sometimes some will clear without treatment and others may need to be removed by either being burned or frozen. Another big thing is skin cancer, which we've kind of talked about that a little bit as well. This is most commonly seen as a basal cell carcinoma, with the largest risk factor being overexposure to the sun. And most people don't take that seriously, but they should, just going out and laying in the sun. Treatment for any type of skin cancer varies, but can include surgery, electrosurgery, cryosurgery, radiation therapy, and chemotherapy. But we also have what we call squamous cell carcinoma, which appears on sun-exposed areas and looks ulcerated or has a crust. This type of cancer invades deeper into the skin than the basal cell and has a greater tendency to spread to other body areas. But remember, we talked about malignant and benign. But when we look at this, we're talking about malignant melanoma, which is the rarest form of skin cancer, but is the most serious. It originates in cells that produce the pigment called melanin. The more melanin you have, the more darker your skin is. Malignant cells may spread through the bloodstream or the lymphatic system, and it can get to your liver, your lungs, and other parts of your body. Also, let's look at some of your endocrine diseases and disorders. You can also find this one. You can actually find all of these different ones inside of your book. Like on the dermatologic is on page 884, table 42.3. And then the gastrointestinal is on page 885 in table 42.4. But let's look at some of your endocrine diseases and disorders just real quick. We have diabetes, of course. This occurs when the pancreas does not secrete enough insulin or the body is resistant to insulin. The endocrinologist would treat any disorder related to the glands. So keep that in mind. For example, thyroid can be deficient in producing the hormone thyroxine, and this results in creatinism in children. Now, when you have an underproduction of thyroxine in adults, the result is called maxedema. The treatment for hypothyroidism consists of thyroid hormone supplements, whereas hypothyroid is also called Graves' disease. This patient may have anxiety, irritability, elevated heart rate and blood pressure, tremors, and weight loss despite an increased appetite. So your treatment includes administration of radioactive iodine, anti-thyroid drugs, or surgery to remove the thyroid gland. Let's see, your gastrointestinal diseases and disorders are on page, let's see, yes, I already told you, 885, 42, 4. Just to name talk a few about these gastrointestinal diseases and disorders. The discomfort from this particular disease and disorder can range from a person having no pain to having severe pain. And what's crazy about this is the less serious problem can be very painful, while life-threatening issues may have no pain symptoms present at all. So that's why a lot of people don't really know that they have more serious things going on with them, other than they have more things going on with them when they don't have any, pain at all going through their situation. So let's just pick out a few of these. Let's look at anal fissures. This is an ulcer in the anal wall, which may develop into a fistula, and this may require surgical repair. Cholecystitis, inflammation of the gallbladder. You have cholelithitis, is a problem with gallstones. So the patient will be advised to avoid fatty foods, which that's what tends to get people having them gallstones, eating too much fatty food. And some people may end up having to get their gallbladder removed. So the patient will be advised to slow down on those. And we can also use a lithotripsy. We can use that to help break down the stones if they're too big inside of the person's gallbladder. We also can give them antibiotics for any type of bacterial infection. Let's get down to diverticulitis. This is an inflammation of the diverticulum or small pockets in the intestine. We can change up the diet. This is normally the initial treatment, but surgery can also be needed as well. Let's look at gastroesophageal reflux, which is known as GERD. This results from gastric acid rising from the stomach into the esophagus. Most people tend to call this acid reflux, but if it's consisting over a long period of time and all the time, it could be a possibility that you have GERD. It's big with having diet modifications by eating small meals. Some people have to take antacids. And one of the big things is making sure a person is eating upright. So after you eat, you want to sit up and eat and try to be up for like several hours so that this food does not push back up, because you need the gastric acids inside of your stomach is what's helping break down that food, and you don't want that to come back up. And the other thing about small meals is you don't want to eat too big of a meals, because you're overstuffing yourself and pushing your stomach out to where you're expanding it to where you don't have enough room for the acids to get around the food to help break it down. Another thing that can happen is surgery, which is normally rare, but it can be used for treatment as well. Let's look down at the hernia. So we get hernias. Those happen when an organ pushes through a muscle or wall containing it. Okay, so the most common is the abdominal hernias. That includes the hiatal hernia and the inguinal hernia. In order to repair this, most of the time surgery is needed to do so. All right, let's go on to neurological diseases and disorders. You have that table on page 42.5. Just take a look at those. Let's just talk a little bit about neurological diseases and disorders. This deals a lot with trauma to the nervous system, and it can cause a loss of sensation. We do have what we call hemiplasia. This is paralysis of on one side of the body. Paraplegia is paralysis on the lower extremities. And then you have quadriplegia, which is paralysis of the arms, legs, and all muscles below the cervical spine injury. Let's take a look at a few of these. We're not going to do all of these because, as I said, you can find the chart on page 886, table 42.5. Let's look at Alzheimer's. So Alzheimer's disease is a disabling disease that involves dementia and deterioration of physical functions. Frequent stimulation may slow deterioration, and medications may slow the progression and of the symptoms, but be certain there is no cure at this particular time. Let's look at Bell's palsy. That is a disease that causes sudden weakness or paralysis on one side of the face because of damage to a facial nerve. The problem usually resolves somewhere between 1 to 8 weeks. So you sometimes don't even need the treatment. Epilepsy, let's look at that one. That is a disease caused by misfiring of nerve groups in the brain, resulting in seizures. A lot of times we give medication as the treatment. Herpes zoster, this disease is called shingles. This is caused by a virus that causes chickenpox that lays dormant inside of a person's body. We can give you medications to relieve pain, but there is vaccines that people can get to help prevent with that, like the shingles vaccine. And now a lot of kids are not getting chickenpox because they have the varicella vaccine. Let's look at migraine headaches. They're caused by vascular disturbances and treatment with various medication options. And then you have, let's look at multiple sclerosis. This is a degenerative disease of the central nervous system. Its anti-inflammatory medications may help, but there is no cure for this either. And then we have Parkinson's disease. Is a progressive neurological disease for which medication is prescribed to relieve the symptoms as well. Let's look at some of your orthopedic diseases. You can find these on page 887, table 42.6. When we're talking about orthopedic diseases and disorders, this involves your musculoskeletal system. As we said earlier, dealing with orthopedics, they tend to work with people who have muscle and skeletal disorders. So one of them will be arthritis. Of course, you know arthritis is inflammation of the joints, while the bursitis is inflammation of one or more bursi. That's just the sacs that surround the joints. To help with this situation, a lot of doctors prescribe anti-inflammatory medications. They may prescribe heat, rest, exercise. They may even send the patient to occupational therapy or physical therapy. They have different types of treatment modalities there, with the addition of surgery for extreme cases. And I know y'all heard a lot of people talk about carpal tunnel syndrome. It's just the compression of the median nerve, which causes your wrist to have pain and numbness. Most time, one thing you can do with that is rest, occupational adjustments, splint of the wrist, injection of corticosteroids, and surgical decompression of the nerve are some treatment options as well. Herniated invertebral disc. This occurs when the contents of the disc protrudes and compress the nerve roots, which we kind of talked about that a little bit in class, where that nerve ending goes running down that spine. You have the disc spaces in between the vertebrae, and if it gets compressed and it starts bulging out and it presses on that nerves, it can cause different types of pain and irritability inside of the body. So some treatment for that could be rest, it could be traction, sending the patient to physical therapy. They may try muscle relaxants, and if at the worst case scenario, they can do surgery if needed it. Let's look at Paget's disease. This is a chronic condition that causes bone deformities. Exercise, dietary supplements, hormone therapy, and other medications may be helpful treatment. Scoliosis is something that is abnormal curvature of the spine, which requires surgery if the back brace that was supplied to the patient is not successful in correcting the problem. We do have sprain. Sprain is an injury to a ligament caused by a joint over extension. Only thing we do for that is rest, support, application of cold and anti-inflammatory medications are recommended as treatment. And then, of course, tendonitis is inflammation of course, the tendon. Same type of treatment, rest, support, anti-inflammatory medications are the treatment options. Now, let's take a look at your allergy exams and tests. Allergy treatments include allergen avoidance, medications, and desensitization to a substance by means of injection. So we may perform a scratch test that checks the patient for specific allergens. Extracts of suspected allergens are applied to the patient's skin, and then scratching it to allow penetration. You put the allergen on the person's skin, and then you take a needle, and a fine needle, and just scratch it to get it into the skin, basically. An intradermal test is more precise. This testing method introduces dilute solutions of allergens into the skin with a fine gauge needle, such as a TB test. A TB test is a type of intradermal test. The patch test, this is done by placing a lining or a paper patch over the skin and using a dropper to soak the patch with the suspected allergen. This test is used to discover the cause of contact dermatitis. And then, of course, last, the radioallergosorbent test, which is known as RAS. This measures blood levels of antibodies to specific allergens, and the RAS test is what we consider to be the most accurate, but also the most expensive test out there. Some of our cardiology exams, an electrocardiograph provides a measurement of the heart's electrical activity, whereas we use a stress test, which is involved in recording an electrocardiogram while the patient is exercising on a stationary bike. They can also be on a treadmill or a stair stepper. So when you have a patient that's coming in for a stress test, you want to make sure that you let them know they need to come as comfortable as possible, wearing tennis shoes, loose fitting pants or shorts, t-shirt, because they are going to be on a stationary bike, a treadmill, or a stair stepper. So they're trying to get the heart at work, trying to raise that heart rate up and see what it does under pressure or under stress. The chemical stress test can be given to the patients who are unable to perform the exercises required by a basic stress test. Another thing that we use is a Holter monitor, which is an ECG device that includes a digital recorder, allowing readings to be taken over a specific period of time. So when you put this Holter monitor on the patient, you're putting it on them for 24 to 48 hours, could possibly up to 72 hours, just depends on how long the physician wants to monitor a person's heart and see what the heart is actually doing during that activity. But it is very important that the patient wears the device at home and keep a journal of the activity to compare the readings. Another thing that you want to be able to tell your patient is not to submerge their body in water and not to take it off, because it is supposed to be on at all times. So during the time that they're wearing this Holter monitor, they may have to do what we call bird baths. Let's look at the cardiology radiography and imaging techniques. We'll look at some of these as well. Radiography and imaging techniques are also used extensively for cardiology exams. There can be a chest x-ray, which can reveal conditions such as cardiac enlargement. We may use a fluoroscopy. The studies are used with x-ray exams and with a contrast medium. And this is injected, and once it's injected and the pictures of the heart is in motion, are projected into a closed circuit television screen. A venogram allows evaluation of the deep veins of the legs. And then we have an angiograph, which is an x-ray examination of the blood vessels after the injection of a contrast medium has been injected. Anytime your doctor says they want a contrast medium, you always want to make sure that when you go and do a particular thing like an MRI or a CT scan or x-ray, they say they want a contrast medium, make sure that you always check MRI with contrast or CT scan with contrast. because this really highlights the areas that cannot be necessarily seen by the machine, but it will give you a more accurate visual of what is wrong inside that person's body. Let's go down to cardiac catheterization. Cardiac catheterization is an invasive diagnostic method is in which a catheter is inserted into a vein or an artery in the arm or leg and passed through the blood vessels into the heart, which we kind of talked a little bit about that last week as well. During the cardiac catheterization, the cardiologist may choose to perform a balloon angioplasty to open partially blocked coronary arteries. So sometimes they may have to use a metal mesh tube known as a stent to place it inside of the artery just to keep it open. If the blockage is extensive, then the patient may need to go through surgery known as a coronary artery bypass graft, which is known as CABG. Some of your dermatology exams, okay? So during a whole body skin exam, your dermatologist can see the visible top layer of the entire surface of the skin. This includes the scalp, the genitalia area, and the area between the toes. A magnifying lens and bright light will be used in any suspicious areas. And then they can also use a wood light examination in which the licensed practitioner inspects the patient's skin under an ultraviolet lamp in a darkened room. Almost like when we did the hand washing thing where we put stuff on our hands and you go in a dark room and use that light. But this will aid in any type of diagnosis. Then your endocrine exams and tests are done initially with palpation or osculation. Sometimes you may have to get a urine and blood test collected, and then x-rays and iodine scans are also used. And we can also use ultrasound, which also can be employed to view glands or detect any type of tumors that the patient may have. Gastrointestinal exams cover the alimentary canal and the accessory organs. So the endoscopy refers to any procedure in which a scope is used to visually inspect a canal or cavity within a body. The perio endoscopy involves inserting the scope by way of the mouth. That's where the patient is laying on their back and they have it running through the mouth, and they have a camera on it and they're able to visually see. So the patient will be also sedated and the gag reflex is inhibited with a local anesthetic. The perio endoscopic procedure includes esophagoscopy, gastroscopy, duodenoscopy, and pendoscopy. These are also referred to as esophageal-gastroduodenoscopy. Your colonoscopy, which we talked about before, is performed by inserting a colonoscope through the anus for direct visualization of the large intestine. And then the proctoscopy is an examination of the lower rectum and anal canal to detect your hemorrhoids, your polyps, your fissures, and abscess. And then sigmoidoscopy, which you probably heard around the way but never really understood it, is similar to the colonoscopy, except the sigmoid area of the large intestine is examined. This will aid in diagnosing colon cancer, ulcerations, polyps, tumors, bleeding, and other lower intestinal problems. There are some diagnostic and laboratory tests, and this is done to determine the presence of bacterial or bleeding, such as your cholecystograph. This is a gallbladder function test. This is performed by X-ray with a contrast agent. And then you have the ultrasound that is used for diagnosing problems in the gallbladder, the pancreas, spleen, and the liver. We also do what we call barium swallows. This is called an upper GI series and is used to detect abnormalities in the esophagus, the stomach, and small intestines. But we also have what we call a barium that can also be used. It's called barium enema that can also be used for a lower GI series. The same contrast medium is used prior to the X-ray as well. Radionucleotide imaging is done with an injection of radioactive substance prior to body imaging. The patient is scanned or photographed with a gamma camera, which can read the radioactive areas to determine abnormalities. The technique is commonly used for liver, spleen, thyroid, and bone scans. All right, so some neurologic exams. The neurologist evaluates 5 categories of neurologic function in a complete exam. The first one will be cognitive factors, which deal with the mental status. Number 2 would be cranial nerves. 3, motor system. 4, reflexes, and 5 is your sensory system. In electroencephalography records the electrical activity of the brain on a strip of graph paper, just like you would for ECG. This can be used to detect conditions such as tumors, seizure disorders, or any type of brain injury that the patient could have. Imaging procedures may vary according to circumstances. People with I'm not going to go over all these, but cerebral angiograph is a study of cerebral blood vessels after a contrast medium is injected into the artery. A brain scan is performed by injecting the patient with radioisotopes, which then gathers in areas of abnormality such as tumors or abscess. And then, of course, the CT scan, which is the computed tomography, and a radiographic exam that produces a 3D dimensional cross-sectional view of the brain. This can be done with or without a contrast to identify tumors, blood clots, and brain swelling. So make sure, like I said earlier, if your physician wants with contrast, it's very important that you make sure you check it. Magnetic resonance, which is your MRIs, is a viewing technique that enables licensed practitioners to see areas inside the body without exposing the patient to x-rays or surgery. A powerful magnetic field produces an image of the internal body structures. This is a machine that is huge, round. It's almost like a donut with one opening on the side, but it's completely closed in except for the area where your feet is. Let's go down to skull x-ray. It may be used to detect skull fractures and to locate tumors. A test that does not involve imaging techniques is an electromyograph. This is used to detect neuromuscular disorders or nerve damage. So needle electrodes are inserted into some of the patient's skeletal muscles, and when the muscle actually contracts, a monitor records nerve impulses and measures the conduction time. Oncology exams and diagnostic testing. Oncology exams and diagnostic testing include a biopsy. It can be x-rays, CT scans, MRIs, and blood testing to detect tumor markers, such as the CEA, or the CA-125, and the CEA is just increased levels of CEA that indicate a variety of cancers. The CA-125 and then the CA-115-3. The ultrasonograph may also be used as well. So your cancer treatment will fall into one or more of 3 categories. It can either fall into surgery, radiation, or chemotherapy. Surgery involves removal of the tumor or surrounding tissues thereof, whereas radiation therapy uses radiation to kill and stop the growth of the tumor cells. But when you're dealing with chemotherapy, this is used in combination with the other 2 categories. But this is a strong anti-cancer drug and is designed to kill malignant cells. Orthopedic exams and procedures. An orthopedist uses inspection, palpation, and diagnostic tests to assist the structure and function of the musculoskeletal system, because as I said earlier, we're dealing with muscles and we're dealing with the skeletal system. Bones and muscle biopsies may be performed to detect disorders such as bone infections and muscle atrophy. Electromyograph is also used, and sometimes the doctor may do urine and blood tests. These can actually detect levels of substances such as calcium and phosphorus. Radiographic exams will include x-ray, CT scans, MRIs, angiograph, myelograph, discograph, arthrograph, and bone scans. Now, arthroscope enables the orthopedist to see inside of a joint. Usually it's the knee, shoulder, hip, or hip with an arthroscope. The instrument includes an optical system to view degenerative joint disease and to guide surgical procedures. All right, this is the end of chapter 42. If you have any questions, please bring them to class. Thank you.